Roberta del Campo is a board-certified dermatologist and future leader of the American Society of Dermatologic Surgery. She is known for her attention to detail and the ability to develop individualized treatment plans for each patient. She has also been an Aerolase Neo user since August 2018, and we do want to give a giant shout out to our good friends over at Aerolase for co-hosting today's virtual practice workshop. So welcome, Dr. Roberta del Campo, and thank you so much for being here with us today.
Thank you, Audrey, and thank you everyone for tuning in. I'm really excited to share my knowledge and expertise with this fantastic device. As Audrey mentioned, it's a device that I've been utilizing over the last 2 years, and it is my most popular treatment in my office. I actually have many patients that come in specifically for this treatment per recommendations from other patients. So it's a fantastic device, and I'm just so passionate about it that I always feel privileged to be asked to speak about it on behalf of Aerolase. So, what I'd like to cover today really is, as Audrey mentioned, the growing millennial market. We know that young patients are our future, and young patients are, the future of our business, because they're the patients that are going to drive in new opportunities. So tonight we'll be diving into a subject that's been on the mind of many businesses throughout the industry, and one that I've discussed with a number of physicians and office managers over the past several months, many of my friends that are other dermatologists and aesthetic doctors. And we'll uncover what we've looked at and learned in generating revenue in the changing landscape. The changing landscape, includes COVID, it includes, new technology, it includes advances in our specialty. And really the objective of this presentation is to uncover opportunities in your medical aesthetic practice. So, I'm not talking about overhauling your practice or completely changing what you do, but the idea really is to give you more insight and input and ideas on how to grow and change your practice to drive more patients in. So this is just a little bit about me. I attended Boston University. I went to University of Michigan for my aesthetic training, specifically in dermatology. And I've worked extensively in the aesthetic market. It's my passion. I love lasers. I love energy-based devices. And so this is an area that I really tend to gravitate towards and really put a lot of time and energy into this aspect. So how did I get here? How did I become an aesthetic dermatologist? Well, interestingly, I grew up and struggled with melasma since I was in my teenage years. So I had it quite young. And therefore, this really drove me to, to a dermatologist to evaluate my skin, tell me how to improve my skin. And, through the years, I really saw the benefit of being able to help others to feel more confident in their skin. So really my struggle with melasma and my struggle with a skin condition drove me to where I am today. I did a cosmetic rotation in residency, as many of us do, and I then saw my passion for not only dermatology, but specifically in the aesthetic realm. So I started really diving into lasers and injectables, and I found this quite fascinating, and that I could use my artistic eye and my artistic skills and combine that with the medical side of dermatology. When I first graduated, I joined and I think this is pertinent because understanding my background in lasers and aesthetics, I joined a very prominent practice here in Miami that specialized in aesthetic devices. It was a practice that I really grew over about five and a half years. And I grew so much that I decided I really wanted to take it to the next level. So I opened my own practice. I built out a space. I purchased many devices, and the very first device that I purchased for my practice was the Aerolase Neo Elite. And it was really my first device because in my mind, it really covered all aspects of what I wanted for my practice. I wanted a device that could be utilized on all skin tones, a device that was extremely safe, a device that I could have a secondary provider use without worrying, but just as importantly, a device that was very efficacious and that was able to really treat my patients, make them happy, and drive in a new following. Because again, I started my own practice, so I needed to grow, and I saw this as a perfect fit for my, my first device to help my practice grow, and it really has. So let's go ahead and focus on the millennials. We do know that experts say it's important to offer unique services. And as you will see, and as I dive in a little bit deeper about millennials, millennials are looking for uniqueness. And your practice will grow by being unique. You need to be able to differentiate yourself from other practices, specifically practices in the area that have other similar techniques and technologies. So what can you do to be different? What can you do to draw attention to your practice? And what can you do to maximize that wow factor with your patients? So why are millennials so important? As we know, millennials tend to be very proactive, not reactive. So they're really that young generation that are looking for the future. How can they prevent the aging process? How can they improve their skin quality and health to prevent more procedures down the road? You know, we know that they're very loyal, and we'll get into that loyalness, but once they find a provider that they like and that they connect with, they will continue to come back and they will continue to send their friends and help you to grow your practice. So it's really important to focus on this group to not only bring, you know, a new kind of taste and flair to your practice, but really use them in a way that they can help bring that visibility to your practice through social media, through referrals, and through that excitement that millennials have. So what are they looking for? I think it's important to understand that millennials can be slightly different than other patient populations that you've worked with. Millennials tend to want a quick, fast treatment. They want to get something done and run to their next task. They want something with little to no downtime. So they don't want the effects of wounding and healing, but they want to see the results. They also really are looking for a customized experience. And that's where being able to combine different treatments and really give a bespoke treatment plan, or what I tell my patients is a comprehensive treatment plan, is really, really important. It's important to understand the differences because this is how you're going to target that market and really drive those patients in. You need to offer solutions that are going to give them, you know, long-term results, happy, you know, customers, and results that are going to force them again to drive in their clients, their patients, their, you know, their other friends, their social media connections, if you will. And really, more patients you have coming in, the broader that reach is going to be. So let's look at the differences between, you know, an older population, the millennials, and the millennials in general, but two different sides of it. You know, we know that there is going to be a common thread between all patients. They all have a common thread in terms of their skin concerns. But what is the difference? So we know 73% of procedures performed address anti-aging. And this is really important because the commonality between the older and the younger population is always anti-aging. They want to address these aesthetic concerns that will address not only signs of aging, but also how they prevent that aging process. So how are we going to separate these? We're going to separate into lower end of the age spectrum and then the higher end of the age spectrum. So younger patients, prejuvenation. And this is an important word that I use, frankly, with even my older population. I know we're focusing on millennials here, but I think to be able to explain that no matter what your age is, you can be 75 and you also are kind of in that prejuvenation because you're not 80, you're not 90, and you're trying to rejuvenate and prejuvenate. But specifically, this is most important with our younger population because they are so focused on how do I keep my skin looking good? How do I prevent the aging process? What treatments do I need? And one thing I'll also point out about millennials is I find that they are very treatment driven. They want treatments. They don't want to be told, use this cream and go home. They want to know, what can you do for me in your office to make me look good today? And what can I do that's different than my friends so that I'm unique and I feel special? The older population, again, I think prejuvenation should frankly be used with your whole clientele, your whole patient base. But what is a little bit different with the older population? They actually have that sun damage. So they already have the visible signs of aging. They have sun damage, they have facial redness, they have fine lines and wrinkles, age spots, melasma, hyperpigmentation. So not only are you trying to prevent, but you're also really focused on correction. So one thing that I always mention to both, aspects of my patients, whether they're young or old, but specifically with the older is we're not just trying to prevent, but we're trying to correct. We're not just trying to correct, but we're trying to prevent. So prevention and correction go hand in hand, and we really need to treat both of those aspects to give you the maximum results. So let's go ahead and dive into the top 5 characteristics of millennials that will help you to grow your practice. As mentioned, information about millennials is pretty extensive. We know that their skin health desires are slightly different, maybe than our older population, and they do have slightly different expectations and needs. So how do we address that? Basically, we want to streamline our operation to really figure out what is going to fit that millennial opportunity. And we know that there are really 5 things that we can focus on. They're going to attract and delight this, specific patient clientele. So I'm going to go through each one by one and discuss not only what we know, but how I have gone ahead and brought that into my practice and found success. So the first is a customized experience. And I can't stress this enough. I would say that out of anything that I've really focused on in my practice, this has been the game changer. I made, a commitment to myself when I left my other practice that I wanted to be unique. I wanted to offer treatments that were very personalized. I wanted to offer treatments that were slightly different than my, my counterparts. And I really wanted to distinguish myself as being a unique provider and a provider who gave a comprehensive treatment plan. It's important to do this because once you bring those patients in and they trust you and they see the difference, they will continue to come back because they're going to build a relationship with you. One thing I also mention to my patients, and I think it's a little bit of that, I wouldn't say reverse psychology, but kind of getting into their brain a little bit, is every new patient that I meet, I say from the beginning, look, let's have an open discussion. Let's talk, because I want to build a relationship with you where I get to know you better than any other provider, and I get to know you better than anyone else you've ever seen, because this way I can give you the ultimate outcome. I want to make sure that this is a two-way street, that I'm able to come to you, come to me, and we can have open discussion on how to reach your treatment goals. And when you mention to them that you're looking to build a relationship from your end as well, they're going to feel the desire to build a relationship with you. They're going to feel that you have that interest, which you do genuinely, and you should, to build a relationship where you're going to be able to grow and you're going to be able to really assess how they're moving, how they're changing year by year, month by month, because you are going to be able to maximize those benefits for them. But also you're going to have that trust, and they're going to have that trust in you, that you are a team and you're looking to give and take together. Millennials also are looking, as we know, to really see those quick results and gratification. Interestingly, I would say out of, many devices that I've worked with in my career, it's quite fascinating that out of any device, more of my patients come back with the Neo Elite and really say, wow, I noticed an improvement with that one treatment. People were asking me what I did. My pores look tighter, my skin looked more radiant, but I don't understand because I really had no downtime. There was no pain. How did this work? And that's what drives them back. If they go home and they do one treatment and they see nothing, even if you explain to them, look, just, give it 2, 3, 4 more treatments, you're going to see results. It's very hard to maintain that millennial population because they want to see the results right away. They want to feel the gratification. They want other people to mention how good they look. So it's really important that when you're assessing what to bring into your practice and what's going to be the most, financially beneficial for you, you really need to look at treatments that are going to give immediate, fast results. And, one good example is really Amazon Prime. I will tell you that I'm a big lover of Amazon Prime because I know when I order, it's going to be at my doorstep within 1, 2, 3 days. It's a fast turnover. When I need a car to pick me up and take me somewhere, I call Uber. It's quick, it's fast. When I want food delivery, I can call DoorDash or Instacart, and I'm going to have it at my doorstep within a couple hours. And this is what we're used to. This is what others want. And I think you really have to understand where the direction of the world really is going, not just in aesthetics, but everybody's looking for fast-paced, quick results, quick treatments. They want what they want and they want it now. And this is something that we need to be able to supply to our patients to have them come back to us. One quick thing I also wanted to mention, going back to the quick, fast results, because as I'm sitting here thinking, what brings my patients back? It is the immediate results from one treatment, it's immediate results from two treatments, but really that combination therapy, when you start adding in, 2, 3 steps, it's going to boost it. And, quick example I have is I commonly will use a little exfoliation pad or do a very light peel after my Airlace treatment. Not only is it going to improve their results, but they're going to leave the office with even more radiance, even more glow. They're going to feel tighter. They're going to feel like their skin looks and technically feels different. So being able to combine those different therapies is going to give them, a boost at that moment. They're going to see the results faster. They're going to feel the results faster. So, going back to combination therapies, it's really important to consider what your patients are looking for and how being able to combine different aspects of your practice within one visit is going to be able to drive them back. It's going to give them those more immediate, fantastic results for quicker gratification. So specifically about technology, I think this is important because as I mentioned previously, gone are the times with here, let me just write a prescription for a cream. Now the time is I want a treatment. I want to see something now. I want to feel something. I want to know I'm getting the best technology out there. So it's important to utilize technology advanced treatments to address their concerns when that's what needs to happen. So obviously you don't want to push something that they don't need, but many skincare concerns that we have and our patients have can be treated with technologies. So, patient experience is driving that change in medicine, and we need to go ahead and address those changes and really figure out how we can utilize technology in our treatment plan. When you utilize, a technology that a patient wants, they're going to be happier. And as we know, healthcare executives are saying, look, patient experience is number 1 priority. I feel this way with my patients. If they come in, they have a great experience, they leave happy, they will come back. So this is going to include, the millennials, the older population, but having them leave gratified is going to have them come back and then refer other patients. So keeping in mind as well that this millennial population, they're willing and wanting to do that preventative treatment. So they're looking to do Botox and PRP, energy-based devices, radio frequency, lasers. So figure out what they need, talk to them about their treatment options, and then develop a comprehensive treatment plan utilizing technology and educate them about this. Explain to your patients that it's not just about Botox, because they can go to, a little small, spa and get that done by somebody that they may not deem an expert. You are the expert. You are the one that says, I would combine this, and this to give you the ultimate results. So, a quick example, I had a patient who came in today who was new to my practice, and she came in specifically saying, I want to have microneedling. I have sun damage. So, my question is, well, what have you heard about microneedling? What intrigued you about microneedling? Do you know somebody who's had it, etc.? And they talked to me a little bit about, so kind of put it in their corner, say, okay, I completely understand. I love this technique, but, looking at your skin thoroughly, I noticed this, and this. Do I think microneedling is a good fit? Sure, I do. But I also think we need to consider treating, some of the pigment discoloration, some of the dilated blood vessels. Let's go ahead and talk about this laser in combination with the microneedling, because the laser is going to go deeper. It's going to help with color correction. Let's then add on the microneedling to address the more superficial concerns, the textural changes. But as you can imagine, hand in hand, we're going to address the top down, and we're going to address all the different skin concerns that I'm seeing that we need to address to give you the maximum results. So let's go ahead and take a step back and understand this one technique will not fix everything. How can we combine these different technologies to give you those ultimate results. And this is going to separate you from any other provider that is just going to quickly say, okay, yeah, we can do the microneedling and send them away, because they will not be as happy, with the results as if you do this comprehensive treatment plan that makes you different and unique from other providers. So it's also important, since we're talking about technology and advanced treatments, it's important to understand that traditional medicine is, we're typically moving away from that a little bit. We're looking for these natural results and remedies, but we're using new advanced techniques. Millennials are always looking for the new best thing. They're always looking for the most popular treatment, what everyone else is doing to an extent, but what they can also do that's different, that's going to make them unique, that's going to give them the edge. They always want to be better, better, better. So it's important to understand what the newest, latest, most advanced options are, because they will pay for these treatments. They will pay for these supreme premium experiences. They're willing to invest in treatments, they're willing to invest in you, and they're willing to invest in themselves, most importantly. So that's why it's important for you to talk to these patients about the uniqueness of the treatment. I always stress to my patients how, and I'm going back to the Neo Elite because it is my most popular treatment, but how it is different than other devices on the market. Why is it so special? Why did I choose this as the first device that I bought for my practice? And I'm very personal, which I'll dive into, but I'm very personal with my patients. I explain, what I dealt with as, a teenager, why I became a dermatologist, and most importantly, why I invested in certain technologies in my practice. I always point out, I bought this device, frankly, because I wanted it for me. I had melasma. I had heard this was a great device for melasma. I demoed it. I saw the results after one treatment and I was sold. So I bought this for myself, meaning because I wanted something that would change my patient's skin, because I knew if it worked that well on me, I'm going to be able to help so many other people out there. And I became a dermatologist to help people because I struggled with my skin. So I think it's important to just kind of let your guard down, talk about what drove you to invest in these techniques and these treatments and these, devices, and specifically talk about why you invested in a particular device, why you're different, why it makes their success more obvious, why they're going to improve because of that different, device that you spent a lot of money on to purchase for the benefit of them. So as I mentioned, with millennials, they'll pay. So when you look at the differences of, cost, so what they're going to pay for a medical visit, and we know that insurance is going down, down, down. We're not making, the profits that we were making before by seeing basic medical patients. Yes, they drive our practices. I love medical dermatology. It was the reason, obviously, I became a dermatologist, not just for the aesthetic side. So I think it's important to continue that, and I will never give up my medical, dermatology practice, but it has become less and less. I see about 10% medical patients, 90% aesthetics. And the reason I point that out is because obviously to survive, we have to have the income to survive our practice and to be able to grow and to be able to give jobs and to be able to become successful. So you have to stop and think that, there is a business side to this. And yes, we want to make patients happy. And that is the most important thing, is to make them happy, and devices will make them happy. But on the business side, we will be able to grow and to invest in more treatments and more opportunities for our patients if we have the appropriate income. So when you look at the amount you can bill for an office visit, sometimes it's as low as $45, $50. We know it can go up to a few hundred. But when you add in an office, in-office laser treatment, and when you add in combination therapies and you see the difference of what you can pull in, that should be a ding, 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 that we need to be offering these treatments for our patients to grow that business side. Catering to a niche and being able to understand how you can drive patient satisfaction with these technologies, but also improve your business, is really, really important. So think about, what makes you different. Think about how to combine therapies. Think about how to give the maximum improvement for our patients, but also look at that need to invest in your practice and in yourself as a provider. So how did I make this happen for my practice? And this is where I'm going to get into my decision to bring on this particular device and how I've been extremely, extremely successful. And I would say that out of any device that I have in my office, I can say it has grown my name in the area because there aren't many providers in the area that have, this particular device. And, I have made it very well known amongst my social media and amongst, my patients that I am very unique with this device, and it drives patients in. So, I want to touch on my laser background. I became extremely interested in energy-based devices when I was at the University of Michigan as a dermatology resident. They had a cosmetic, fellowship at the time. They've unfortunately funding has kind of cut back, and so it's not something they currently offer. But there were several years, and I was the first year that they offered this. And I specifically spent 1 year studying all different, energy-based devices on the market, what we had in our clinics, but also was allowed to demo and work with pretty much any device on the market to get to know, a broader, range of knowledge for me. And this really drove me to work on a project with Tina Alster for the American Society of Dermatologic Surgeons on how to develop an algorithm to help others understand and know how they could grow their business aspect with energy-based devices. So the idea with this algorithm really was to separate what we most commonly see in our practice. So commonly we see sun damage, we see redness, we see dyspigmentation, and then also looking at different devices on the market and what skin concerns they can address and what they cost and what consumables cost and safety profile, the efficacy profile. So I looked at all these different aspects of different energy-based devices on the market, and I literally developed an algorithm with Tina Alster to say, if you have a device, go here. If you don't have a particular device, move here. And it walks you through what to think about and really help to cater the brain into where you would be most business savvy in terms of an energy-based device purchase. I went through all of this and I did this for the ASDS. At the same time, I was personally looking to purchase my very first device. And so I mention this because I think it's important to, again, stop and think where you're looking to go and where you are at that time and what gaps you have. And for me, the one gap I had was a basic energy-based device that could target many different skin concerns with little to no risk, fast results, fast treatments, and something that had little to no consumables. And it drove me to purchase this Aerolase Neo Elite. I also think it's important to mention one more time that I did spend several years in another practice. We did not have this device. We had other basic devices, an IPL, etc. And the IPL was our workhorse at that particular practice. When I was looking to branch out on my own, I knew that there were better devices on the market. And through my extensive research, I nailed on a YAG and said, look, I can do the same things I can do with IPL plus a lot more in a much safer, spectrum, and I can treat all skin tones. And it was very, very important for me to be able to purchase devices and technology in my practice that I could treat any patient, because it opens the market for your business. You don't have to turn anyone away and say no, but also it instills confidence in a patient that this is safe. I can use on any skin tone and send your friends, no matter what, skin type they are, and we can treat them. So this really was my true foundation. This was the very first device that I purchased. It has been my workhorse, and this has been a device that I swear by to help grow my practice and my name in the area. So I've been very, very thankful to have, I wouldn't say stumbled upon, because there's a lot of research going into this, but I spent a lot of time and picked this device as my first device, and it was the best investment I've made for my practice by far. So going a little bit into my strategy with the millennial approach. Again, I mentioned this earlier, being authentic, I think, is so important. I mentioned to every patient that I'm here to help you. I kind of take my guard down. I tend to have a very personable relationship with all of my patients. I always make small talk, ask them how their families, where do they come from, how did they hear about the office. I get to know what they like, what they don't like. And, I try to be authentic with myself. I let them know the treatments I've tried, what I like. Obviously I bring in treatments that I do myself, and I can tell them, look, I do this. I post it on my Instagram. I show my personal results. And it instills confidence, and they know, oh, you're doing it. Well, you have great skin. Obviously it's working. Or you're doing it. You're an educated dermatologist. Obviously this is the best treatment out there. They know that my staff do these treatments. So I make sure to post on my social media, all of the treatments that my staff do, and really highlight how happy they are, because again, it's going to instill confidence. If you recommend something that you've never tried, or you recommend something that doesn't, you don't get results from, or your staff doesn't get results from, they're not going to be as driven. It's not going to be as powerful. So be authentic, show a personal side of yourself, show them your results, show them, who you are, and educate them. I think it's important, I spend a good 5, 10, 15 minutes, depending on how many treatments I'm talking about, but I really educate them on what they're gonna, what results they're gonna see, what's different about these treatments, how they're gonna really benefit from this combination therapy. And you spend an extra 5, 10 minutes talking, and I can assure you, they're gonna be coming back again and again and again, and they're gonna trust exactly what you're saying, and they're gonna book on the way out. They're not gonna say, I'll call you if I decide to do the treatment. They're gonna book because they're gonna be sold. And it obviously should be authentic. You should really be discussing, what the real results are, what they can expect, but, showing true, genuine passion. And when you have a device that you're passionate about, it's easy. And that's something I'm told often with this device, is I do love it so much. And I always say, look, it's all over my Instagram. This is how obsessed I am with this treatment. This is how obsessed my patients are. And I have, very well-known patients in my community that are willing and wanting to step out and talk about their excitement and do these videos and share their experiences, because they're so happy about the results. So, put it out there, tell them how excited you are, and they're going to join in and jump on the bandwagon. So in my practice specifically, these are the common skin concerns that I specifically work on. I tend to do a lot of skin rejuvenation. We do a lot of, rosacea, acne. I think it's important, to really understand what the common concerns are within your patient population, but also find something that's a niche for you. And I point this out because I've had a lot of success, and I've grown my practice a lot over the last year, specifically with melasma. Why? Because I offer the Neo Elite treatment, and I will tell you that, as you can see if you follow me on Instagram, after this, this discussion, you will see a lot of videos, pictures, patient reports of the improvement of melasma with this technology. And I really found that my passion, why I became a dermatologist in terms of my own melasma struggle and being able to show my improvement. Day to day, I had patients say, you don't have melasma, your skin's amazing. And I say, yes, because I do this, this, and this, and this. And I do the Airlace Neo Elite. I do it every 2 months. I could probably do it more, finding the time sometimes can be challenging, but I explained to them, this was my perfect solution, and has been my perfect solution for the last 2 years. And I've had many, many patients that have really turned the corner with this technology, and it has driven more and more patients to my practice. I've had patients coming in saying, I came to you because no one else has helped me with my melasma, and my friend came to see you for melasma and her skin is fantastic. And oh, I saw on your Instagram that you focus on melasma, and I've never seen results like that before. I want to come in and see what you can recommend. And then I explain why I treat in a combination approach, and why the results are so good with, their friends or what they see on Instagram, is because I do offer a unique treatment that nobody else in my area tends to do. So I think the point is finding that niche, whether it's melasma, whether it's a very unique way that you treat acne with the Airlace Neo Elite plus certain topicals, and calling it your kind of combination approach treatment, is the way to go for sure. But find that niche, find what makes you different, and find what is most common and popular in your area, because every area in the country, different patient populations will warrant a different, clientele and what their skin concerns are. So this just highlights, what has been very popular in my area. I'd also like to mention that being in Miami, I deal with a lot of ethnic skin, specifically, Hispanic, Latin American skin, so olive skin tones. And again, this is where I've really tailored and found my niche for my practice. I always talk to my patients about me investing in devices, specifically this device that is safe on any skin tone. It is safe on tan skin. It is safe on, you know, patients who like to be outdoorsy and in the sun. Obviously, I tell them to protect their investment. But the point is, find that niche. And for me, it was melasma. And for me, it was more olive tone ethnic skin and people who love to be outside, and being able to offer them treatments that are safe in this type of weather and efficacious. So with melasma, specifically understanding the epidermal and, dermal, treatments, I think we need to talk about different technologies, different options that are more traditional, such as hydroquinone, such as, IPL, other laser-based devices. We can have treatments that make melasma worse. We can have treatments that can be irritating to the skin, like hydroquinone. And we can have treatments that just patients don't want to stick with because the adherence is low, maybe because of cost, maybe because of number of treatments needed to see results, maybe because of downtime. But understanding there are these conventional treatments that don't necessarily fit, the patient expectation. So how do we go ahead and treat, or how have I treated specifically my melasma patients to warrant them results, but to not, worry about these other patient issues and concerns for more traditional treatments. So dermal concerns, there's really nothing out there that's considered a first-line therapy, right? And what gets deep enough to really treat that pigment? This is where these traditional light-based therapies can cause rebound pigmentation. They can cause more inflammation. And we know that with melasma, the more red the skin gets, the worse the melasma can get. So, understanding that there are different things that we can address that can improve the melasma in the dermal aspect, but also I think this is very powerful. We're going to also decrease the risk of rebound. We're going to decrease the risk of this, this difficult to treat skin concern coming back, because we know that melasma now can be triggered by vascularity. We know that if you don't improve that vascular component, your melasma is just going to come back with a vengeance. And this is what makes this device very unique. Again, I spend a lot of time talking to my patients about the uniqueness because it's what allows them to build that relationship, build that trust, but I always talk about vascularity. I talk to them about the deep penetration of this laser, not only affecting the pigment that's deep down, but also addressing that vascular component that can lead to more pigmentation, that leads to melanogenesis. So I tell them, look, this is a treatment to not only treat what you have now, but to prevent that melasma from coming back. And I give my example, I recently was blessed to have, I have a 4-month-old now, a beautiful baby. But the point is, one of my biggest fears getting pregnant was, oh no, my melasma is going to get worse. I've had melasma for so long. It's been under such good control now with, my perfect regimen, my perfect treatment. And now it's just going to come back. Interestingly, because time got tight and I had 1,000 things going on, I actually did the Aerolase Neo Elite, the laser treatment, much less often. So I was doing it every 3 or 4 months just because time was busy. I was running out of the office, maybe days I didn't feel well when I was pregnant, and my melasma never flared. And I get goosebumps talking about this because I wasn't even able to use all, some of the topicals, hydroquinone, things that I was using before, doing some of the treatments that I did before, and my melasma never got worse. It stayed exactly the same with less frequent laser treatments and no access to hydroquinone. And that is very powerful for me because I thought for sure I was going to be able to keep it under control with the Neo Elite, but I was going to have to do it every month. I was going to have to keep on top of it because there's no way around it. So the point is that that vascular component, I was a believer in before, and I'm even more of a believer now with my own personal experience. And this is something I really stress with my patients because they're worried about it coming back. Oh, we're going to treat it and it's just going to come back. And I say, not with this device. If you follow my lead and you do exactly what I tell you to do, and you maintain and you stay in and you stay committed to this treatment plan, you will see the results, and you will be happy to know that you will continue with these results for a long, long time. And we can keep your skin looking as fabulous as it does after the first treatment. So here's a picture of my results. This was actually my demo day. On the left, you can see I'm a tiny bit red, and up at the top of the cheek, you can see it's a little bit darker. That's because I actually took the picture right after the treatment. So that's where a little bit of that redness came. But literally this is a week later, and you can see that the melasma was better. The skin tone texture was better. I can assure you, everyone tells me or asks me, was this a filtered picture on the right? No. I mean, it looks filtered because the skin texture is better, the skin quality is better, the brightness is better, the color is better. It is not filtered. Your skin just looks better after the treatment. So those of you that are on the line that have experienced this laser yourself, it is the one telltale sign of a really, really powerful device and a very, very unique device, and that you see the results after just one treatment. And yes, every patient is different. The more damage you have, like you can see there, I had melasma, my skin looked a little dry, dehydrated, needed a boost. I'm going to see better results on someone who has fantastic skin, because you're just not going to see that change with one treatment as you would if you have a lot of damage. But everyone will leave looking in the mirror saying, wow, my skin looks brighter. Wow, it feels tighter. Wow, the pores look smaller. Every single person after that first treatment. And I always tell them, give it a week. If you think it looks good now, in a week, it's going to look better. And it does. In a month, it looks better. And after the second treatment, it looks better. So they keep coming back because they're going to see the results the first time, the first week, the first day, and they're going to continue to see the results with each treatment. So this just goes back to kind of that customized approach. It's very, very important in my mind to combine different therapies because we know it's not a one size fits all. Most of us come in with many different, skin changes over time, but also we're looking to maximize the patient experience and to make ourselves, a unique provider. So I always, stop and I think about what are these different endless combinations. And I'll point everyone to my website, when you have a minute to go to, delcampoderm.com, because I have my menu of services, and you will see that I have developed what we call the Dr. Roberta signature combination therapy. It's kind of a long name, but point is, I always tell my patients, these are my signature treatments. These are the treatments that I personally have developed to maximize your goals and to maximize your results. And you'll see I combine the Neo Elite with microneedling. I combine the Neo Elite with the salt facial. I combine the Neo Elite with a peel. I combine, multiple steps. I combine the Neo Elite with, a peel with microneedling. So the point is, depending on what their concerns are, I have already developed these combination therapies that are very unique. I give them unique names, a rejuvenation duo. And so I don't really dissect it to, oh, you're going to get the laser and then you're going to get microneedling. I say you're getting this combination approach where I have combined different technologies that I have in my office to maximize your results and give you X. So you really want to brand yourself, brand your treatments, but knowing that this particular device can be combined with so many different treatments because it does not break down your skin barrier. It does not compromise your skin. It is a very gentle yet very, very effective treatment. So I feel very comfortable using this technology with every other device I have in my office same day. So that's one of the beauties of this device as well, is you can really combine this with so many different things with no risk, no concern, and they're going to leave happier with these combination therapies. They're going to get faster, better results. So I bought this device, as I mentioned, 2017 when I opened my practice. I paid it off in 3 months. It is the only device that I paid off that quickly. And more shockingly, This is a device that I used personally every single day. I did not have a PA. I did not have an esthetician. I did not have a laser tech. I had just opened my own practice. I was doing every procedure myself. So I could only, obviously I could only do X number of treatments in a given day. So for me to be able to pay this off in 3 months was a wow. I really, really liked, the idea, even for myself, that it was a fast, quick treatment and I was in and out of the room. But also as I grew the practice, I was able to transition this to my laser tech and my PA and my head esthetician. So, I think understanding that you can gain value with this and you can charge, a good amount for, your treatments, and I can give you my pricing, if anyone's interested. But the idea is that this is a very affordable device, and with what you can charge in a 20-30 minute treatment, you can pay this off very, very quickly. It also builds a great network. I mentioned this multiple times, but as you can see here, it has really bringing in one patient who loved it, sent another patient who loved it, sent another patient. And frankly, each one of these influencers were all authentic. So my first influencer loved it so much that she, referred another, and she wanted the treatment and she referred another. And each influencer has grown. And now we're looking at, Larsa Pippen, who is, a very well-known face in our community. And she is someone that personally reached out to me and said, my friend Michelle did it. I see her all over your Instagram. I love it. She's told me all about it. I love the results. When can I come in? When can I speak about this device? I'm excited about it. So you are going to grow authentically. You're going to have people coming to you because they want the treatment and they see the value in the treatment. And so it's a win-win for everyone. You're going to see the results. Your business will grow. And personally, if you're someone like me that likes to do the treatments, you're going to be happy to have a device in your office as well that's going to improve your skin, improve the skin quality health. And I'm going to throw out one other big name because I think this is very, very powerful to end it on. I've worked closely, and Elle McPherson has been a patient of mine for, quite some time. And she is someone that is, and she's been very vocal about it. So this isn't a HIPAA thing, obviously. She's on my Instagram, etc. But she is very well known for health and beauty. And she's very against traditional treatments. She does not do Botox. She doesn't do fillers. She only does, we call natural treatments. So when I talked to her, a couple years ago about doing the Aerolase, I have this fantastic device. Not only is it going to make your skin look better, but it's actually going to make it healthier, stronger, more resilient. It's going to build collagen, and you're going to love it. And there's no downtime, and it's a very healthy, safe treatment. She was on board. So she actually has, spoken to me about working with Aerolase as well, because she loves to speak about health and about beauty, but in a healthy, very safe way. And I say that because that is the direction we are going. We are going towards treatments that have minimal to no downtime, that are going to not only make your skin look better, but be healthier, more strong, more resilient. And it goes with that green effect. And she is kind of the face of that, with her beauty line and with her, supplement. So I just think that's another powerful example of someone who does not want to put anything toxic into their body, is against traditional medicine, against traditional aesthetic medicine and treatments, but really loves this treatment and vouches for it. So I'm going to end on that and just say, establish your loyal customer base by staying unique, concentrating on you, your patients, being an expert, keeping in touch with trends, and, being passionate. And this has been a very authentic growth for me. I'm extremely passionate, as you can tell, about this device. I believe in it. I'm going to throw myself out there, but more than any device that I have ever worked with, because it is just so unique and just such a powerful, powerful device, and I've been blessed to have it in my practice because it has grown my practice more than I ever could have imagined. But find that device for you. This is that device for me. But I will tell you that as you continue to grow, just find ways to use your different devices in combination treatments. But most importantly, make and brand yourself with something that's unique. And again, this Aerolase, Neolite has been that for me, and I hope it can be that for, anyone else listening in, if it isn't already. So thank you very much.
Thank you so much, Dr. Del Campo. I thought that was great. You definitely hit on a ton of key points. Definitely some great things for all of us to consider as we kind of move into the 2021 year, and finding additional ways to not only create revenue streams, increase per patient revenue, but also just to grow our practice overall. So we are going to leave this time open for a live Q&A with attendees. So for those of you who do have any questions, please just jot them down in the question chat box on the right-hand side of your screen, and we will make sure Dr. Del Campo answers all of them right now. All right, so
Okay,
we
and I
do have,
mentioned I would bring
yeah,
myself in so everyone can view me now.
perfect, looks great. So we do have a couple questions already rolling in. The first being, can you provide us with protocol for combination neo-laser treatments? Actually, let me reword this question to make it easier on you. So can you provide us with the protocol for combo neo-laser with other treatments? So if you're doing a combination treatment plan with the neo-laser, what order do you typically do the treatments in that plan in?
Okay, so when I think about energy-based devices, I always go deep first because you don't want to overheat, the epidermal layer. Although this tends to dive obviously a bit deeper because it's a YAG, I always start just in my brain with any device deeper first. So, with the Aerolase Neo Elite, I would do that first, followed by microneedling, or the Neo Elite first, followed by a peel, or the Neo Elite first, followed by, I sometimes do ultrasound cavitation, which is a hydration technique, or with a peel. The Aerolase Neo Elite followed by LED light therapy. The only thing that I put before the Neo Elite would be when we do something called the Miami Corrective Complex, which my esthetician does. And that's a combination approach of the Aerolase Neo Elite with the salt facial device. And she does the salt exfoliation first. So she does, the manual exfoliation basically to prep the skin for the laser. Then she does the Neo Elite, followed by the ultrasound cavitation and then the LED light therapy. So, I mean, I hope that's simple enough, but I would say any energy based device, do the Aerolase Neo Elite first, followed by, something that's a little bit more superficial.
Got it. And another question we have following up with that is, how do you deal with patients complaining of pain during the actual treatment itself?
There's virtually no pain, which I will tell you, I mean, that's a big selling point for me with my patients, because whenever I say laser, somebody who's either never done a laser or done other lasers, they go, does it hurt? And I always say, actually, no. Most of our patients fall asleep. The one time you can get a little zinger is if you're doing, some vessels like around the nose because it's a sensitive area. Obviously, I don't get into that with a patient who has telangiectasias right away. I just say, there's virtually no discomfort. There can be a little blood vessel or two that can feel a little bit more warm and can be a little bit more uncomfortable, but there should never be pain. There will never be pain. And so I would not worry about that. I would say that is actually one of the big selling points, is that it's no longer no pain, no gain. They get great gain with no pain.
Got it. And the next question we have is, which you kind of already answered, but just to make sure everyone can hear the answer, is do you do the laser treatments before microneedling or PRP?
Yes.
Yep.
So the laser first and then the microneedling or PRP.
And then let's see what else we have here. Patient pricing for the Aerolase Neo treatments.
So for full face rejuvenation, so one thing I'd like to just mention is that I am in Miami, so we do charge a little bit more in this, in Miami. And also, I just tend to charge a little bit more compared to the national average. I think I was told the national average is 350, 400. I charge 500, but I do charge 500 also because we do a full face, full rejuvenation treatment, no matter what their skin concern is. So many offices will maybe charge a little bit less if they're just treating brown, or they're just treating red, or they're just, doing acne. I always push my patients. I'm going to give a prime example of acne. Somebody comes in with some acne spots or some acne scars, and they say, oh, I just want to focus here. I go into the spiel of, look, I'm recommending this not only to improve what you have now, but this laser is fantastic for anti-aging. It's fantastic for collagen production. It's fantastic to blend all other discoloration of the skin, tighten pores, improve radiance. So I highly recommend that we focus on the full face. And then I explained that then we go back and target their skin concerns. So the 500 includes 4 full passes over the whole face for tightening, rejuvenation, pore reduction. And then we also spend the time to go back and address individual skin concerns. So then we'll go back and target the melasma or target the sunspots or target, vascularity. It's an extra 10 to 15 minutes, and which is why we charge a little bit more. But frankly, they leave seeing not only their acne spots better, but their skin overall looks fantastic. And again, you want to give them results that they're going to drive them back in. So if they see a little improvement in some acne spots, it's very different than seeing their overall skin looking brighter, fresher, tighter, and improvement in those acne spots. So I always push for full face, which I charge 500. Neck and chest are less, 350 each area, because we add those onto the face. And then if I do have someone who pushes specifically just for acne, then I charge 250.
Got it. And then the next question we have is, let's see, is this device a long pulse YAG laser?
Yes.
Yes. The next question we have is, my current practice does not use this laser. However, this person has been very interested in learning more about the Neo. Do you know how they can receive training on this specific Aerolase laser? I will put this person in touch with Sean, but she says she is also in Miami. Do you have any suggestions, and do you offer training on the laser?
I don't specifically. Now that's something obviously, yes, I would say put in touch with the company and see what their recommendations are. I was trained by a very, very fantastic, well-versed trainer when I purchased the device. So I'm not really sure without owning the device if that's something that they would be willing to train on, but at a minimum doing a demo, because I highly recommend the device. So maybe that's something you can demo and then look to bring into your practice.
Okay. And I think I'll leave another minute. Oh, looks like we just got another one. What laser settings do you use specifically for treating melasma?
So it depends on the skin type. So I always use a 6mm, and then I vary between 4 and 6, level 4 and 6, depending on the skin type. Obviously, if they have darker skin, you want to do a lower energy level because it's going to absorb more heat. And then you can use a higher energy level for somebody who has a fainter melasma or a less dark skin tone. And then I do 4 passes. Well, we do 4 passes over the full face, and then we go back and do 2 additional passes over each melasma patch. But what's important is if you're going to go back and retreat the area, just make sure you move around, because you can build too much heat and then it can either burn the skin or, I mean, it's not such a risk with this particular device, but I have seen where you can get overheated. So treat the melasma patch, then go back, treat the other patch, give it time to cool, go back. You can also use your fingers to cool down that area if you want to stay right there. Make sure that it's not warm to the touch before you do your second pass.
Okay. And I think the only other question we have, and I still will leave another minute or so open, is, let's see here. The best place to find a medical history form for Aerolase procedures that are trendy but not overwhelming to the patient.
Yeah, I think you would have to ask. I mean, I do a very thorough history with any patient who's going to do a cosmetic procedure, whether it's injectables, lasers, but I think specifically with any laser-based device, you just want to, particularly make sure, have they had other treatments, have reactions to it, what products they're on, because that can increase skin sensitivity. And then obviously there are certain very distinct things you should ask about previous, treatment with gold, autoimmune disorders such as lupus that can be reactive to various lights and wavelengths. So, I wouldn't dive too deep into some of those, other, you can find, like you said, extensive lists online. But I think Airlace may or may not have one, but I think the big ones for me are autoimmune disorders. Are they on any medications that can make them more sensitive? Have they been on gold in the past? And then also, obviously, have they had other treatments, specifically lasers, where they've had, reactions to those treatments? Those are kind of the big ones that we tend to ask.
Okay, and it looks like that is it. So thank you so much, Dr. Del Campo, for spending your time with us this evening, for sharing all your expertise.